name's Dr. Gary Martin. I'm a psychiatrist and psychoanalyst here in Denver, Colorado. I've been in private practice and on the volunteer faculty at the University of Colorado Medical Center for about 40 years now. I'm in the process of retiring. But I got a call recently from Rita Crompton about getting some help in bringing this product of Bob Ladon's to market called the 3D sound system. 3D says more about what it's really about, which is not just the sensation, but about what goes on inside the individual, which is what I think is very exciting to see something like this come to market, because that's what my work is all about, is what's going on inside the individual. And this is, I think, an exciting product or system because it not only has usefulness in my field, I think, and we'll talk about that, but I think it also has a tremendous potential for just fun and recreational and just sort of personal enrichment uses. So I think this is going to be a big deal. I really do. And so when I got the email from you to be part of this, I was excited because I thought, I'm 71, I'm retiring. Now I get a chance to be at the beginning of something exciting. And, that's an exciting opportunity for a professional like me to think, that you might be part of a legacy that is quite remarkable. So I'm excited to be part of it, so I hope I can help. I think one thing we've learned about psychological problems is that the sooner we do something and intervene with the patient, the less damage is going to take place in the individual's personality development. So that means, first of all, being attentive to problems like school teachers and mothers and fathers are. And it also means noticing things that are problematic. A child who has trouble concentrating and so forth, or sitting still in a room, obviously that needs to be evaluated carefully and treated. And I've seen many kids over the years who presented with that kind of problem, for example. And helping people to, whether it's children or adults, to learn to regulate their behavior and their cognition, their thinking, or to help them control their mood if that happens to be the more, problematic issue for them. And I think that there's a great potential in all of those realms for this device or aid in improving yourself. But if you put all those three together, somebody who has trouble with their thinking and their mood and their behavior, controlling their impulses and so forth. And the best example, sadly, for what we have right now is PTSD. We have examples of that from Vietnam War, from the Iraq, Afghanistan War, but we also have it from the shootings across the country, that have been enormously traumatic, certainly for the people in those communities and the people affected by those events. So this aid to getting along in life, and it seems like it's an extension of medical practice, but in that regard, but it's I don't know, it fits into a category of stuff I don't have a name for, but it seems to me like people who are dysregulated emotionally and cognitively and behaviorally, like we sometimes see in PTSD, those people, and they're at risk all the time. So going to see a therapist 45 minutes once a week is, it's like whistling in the wind to help these people. And you can dumb them down with medications, but their mind isn't somehow reintegrating itself the way it once had been. And I think something like the sound in 3D has such a compelling effect on the nervous system that it can override, but not overstimulate, it can override internal signals that are out of sorts.
Yeah.
So if you listen to some music, for example, and then held on to, were encompassed by this sound in 3D, I think the benefit to the person is that they get to re-regulate themselves, to kind of reset
Yeah.
what their original psychological circuits were like. They
Yeah.
get to reset them.